Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your host, Gary Dodge.
And Sheena Wapoose. On this episode, we are joined by Vaughn Bowles, the Public Information Officer for the Menominee Indian Tribe of Wisconsin. And before we get started, I would like to remind people that we request that you send in your COVID-19 related questions or topic suggestions to us at podcast@mitw.org.
So, Vaughn, what are the steps for the tribe to begin Phase 3?
All right. Thanks for having me back, guys. Let me start with that. So Phase 3 is a total reopening of the tribe without restrictions, without anyone remote working. Right now, the Back to Action plan has Phase 3 starting when we see a consistent downward trend of positive COVID-19 cases in Menominee County Reservation and in the surrounding counties. We haven't seen that downward trend in surrounding counties, especially in Shawano County. And so that's why we're still holding steady at a Phase 2 type of operation where we have half of our employees offsite. But once we see that, positive cases are going down and hopefully below 5% of all, tests run, that's when we'll move back to a Phase 3 type of scenario.
All right, and I kind of got a crystal ball kind of question. Do you think we'll hit Phase 3 this year?
Will we hit it this year? So that depends. And I know you guys love hearing that.
It's Vaughn's catchphrase.
It's my catchphrase. It's science and it depends. It really depends on how soon they see vaccines go into production for COVID-19. It also could depend on, how the seasonal flu and the temperature changes affect the spread of COVID. We might see it. I don't know. Optimistically, I would say yes. Realistically, I'd say probably not by the end of the year. But I don't direct any of the departments. I'm not in charge of how the tribe runs. So just talk to your employers, talk to your supervisors. Just keep in touch with them to know what's going on with how the tribe's going to be run.
All right. So this week in the news, we had a vaccine from AstraZeneca that was being tested and possibly caused a case of a serious neurological problem for that participant. How will this affect the vaccine going forward?
Let me preface this with, as much as I'd like to, I haven't been able to follow all the large-scale trials that are going on for COVID vaccines right now because there are a lot of them in development. It's unfortunate that there was a participant in the AstraZeneca test that experienced, serious neurological conditions. But that's also the purpose of these tests, is to flush out whether or not there are these potential hazards posed by certain vaccines. And as much as we've learned over the last 200 years about, biology and physiology and molecular biology, even, there's still, we all have a lot to learn, particularly when it comes to things like vaccines in our immune system. But, when they take vaccines to human trials, they're testing those against placebos. And they're basically trying to find out whether or not the benefit's going to outweigh the potential risk. Sometimes people have side effects, in cases of like 1 in 100,000 or like 1 in 500,000, which one of these large scale tests may or may not catch. So even for, approval and production and release into the public, these vaccines are going to be monitored for a long time. That said, if we look at the AstraZeneca trial and, just to simplify it for us, let's say they have 10,000 people in their trial and 1 to 2 of those individuals have an adverse reaction to the vaccine. That's a 0.02% chance of having an adverse reaction is what they call one of these responses. If you extrapolate that out to, the United States population, we have 330 million people. That potentially could be, 33 to 66,000 people that have a similar type of, neurological reaction to this vaccine. And that may be enough for the Advisory Committee on Immunization Practices to prevent it from getting FDA approval. That said, there are a lot of vaccines in production. Hopefully they choose the ones that have the most beneficial results. And so I'm not saying this is going to spell doom for AstraZeneca's, hopes and dreams, but this may be a sign that they need to go back and refine their process at this point. And so hopefully they're going to bring the safest vaccines to market. So that's what we're hoping for. And they're really trying to push these forward as quickly as possible, which, is something we're all hoping they can do safely.
Right. So also this past week, we've seen a pretty big jump in cases in Shawano County. Can you talk a little bit about why that may be?
I've heard some anecdotal evidence of why things may or may not be rising in Shawano County still. There have been individuals that have, after speaking with Dr. Schlegel and Vicki Dantoin from the Shawano County Public Health Center, we found out there are individuals that are, refusing to quarantine after they've tested positive. There's even been one account of an individual trying to intentionally infect other people because they're upset and they blamed someone else for them getting it. And so, there's a lot of complications that come into practice when you're dealing with a high stress situation, people dealing with having been quarantined for extended period of times, strains on finances and things like that. And so, it's hard to predict what people will do in these type of scenarios. Right now, we're not seeing any specific hotspots of people going to, Save-A-Lot and, picking up COVID on a wide scale basis. But there have been people that have, made choices to gather in large groups indoors and have, accidentally passed it to each other. So there's no one event that we can pin down for saying this is why it's rise. There's a lot of small things that people can do, and it may be lapses in judgment, or people are just tired of hearing about it, which is possible. But if they want to prevent or slow the spread of the disease, they need to take the precautions that we've known about for months. Washing hands, staying away from large groups, wearing masks in public when you're around people, things like that. It's those simple preventative measures that some people are lapsing on that may be part of the reason that it's increasing right now.
I was going to ask, do you see in the future that within the next few weeks, it rising again due to the fair?
Maybe. The fair has been one of the issues that we've talked about for a long time and has made us really nervous, just because there are so many common surfaces that people touch, and just because people have the habit of touching their face so frequently. So we're kind of crossing our fingers, and we're really hoping we don't see a spike due to the fair. That said, we'll just keep an eye on the number of cases.
So it was rather cool this week in the weather, and kind of brings up spooky season vibes. So I was wondering about Halloween and trick-or-treating, and if you have any news on the tribe's decisions on how that is going to be affected this year.
Yeah, Halloween. We actually started discussing Halloween in our incident command meeting this last Thursday. And at this point, we want to wait and see what happened with the fair, just like we talked about, to see if there is a potential spike. And if Halloween, because I know we do a community trick-or-treating event at college, we want to see if that would be something we still might be able to do, or if it's something we definitely need to cancel due to the risks of having so many people in one specific area. I know it's an outdoor activity, but there's still a potential for a lot of spread when you get that many people together. So we're gonna hold off on that. We'll probably know more about it in a week or two, and then we'll be able to update more people about what's going to go on with Halloween and the planning of that activity.
Okay. Thank you for coming on, Vaughn, as usual. It's always...
Sorry, I have one more thing.
That's okay. No, that's fine. That's fine.
I'm sorry. So the Shawano-Menominee Shawano-Menominee County Public Health Office, there we go, got it. They're actually holding a COVID testing event September 15th and 16th, which will be a Tuesday and Wednesday. It'll be from 9 a.m. to 5 p.m. It'll be at the Shawano Fairgrounds. It's open to anyone who wants to be tested for COVID-19, anyone who's experiencing symptoms or is just curious if they have it at this time. So that will be available for anyone living within the county or on the reservation. So if you have questions, you have the opportunity to be tested.
Great. Thanks. Yeah, I was going to ask you to bring that up, but it's fine. You got there before me. So and besides that, was there any other parting thoughts that you wanted to give for people for the weekend?
Wash your hands. Stay safe, people. Thanks for all the help you guys have had. Shawano has one of the lowest, caseloads and stuff in the state still. I think you guys have done a fantastic job of keeping COVID out of the community. So thank you for helping us.
Waimanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the community tab, and keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we do welcome any community questions you have regarding COVID-19, so please send those into us via email at podcast@mitw.org.